These are the supplements that you need to absolutely avoid if you're taking these certain types of medications. The very first one that I think is a very popular one that people do use is 5-HTP. So if you're taking 5-HTP, why this is a concern is 5-HTP, what it does, it helps with the serotonin pathway and helps increase serotonin levels. Now, if you are someone that is taking something like an antidepressant, this can cause some significant issues where not only will it increase those levels of serotonin along with the antidepressant, it will lead into possibly increasing exponential levels of serotonin, which can lead into serotonin syndrome. Now, I have seen this firsthand of seeing serotonin syndrome, and it's not a pretty picture. You'll have definitely a lot of mood imbalances. You'll feel very agitated, stressed, can't function. You do not want to have to put yourself in this situation. So you definitely should be careful on taking something like 5-HTP if you're taking any kind of antidepressant. That being said, it's also good to keep in mind by taking something like 5-HTP, it can also interact with ADHD medications. And this is where you should be talking with your doctor first before deciding to take 5-HTP with even ADHD medications such as like Ritalin or Adderall. The second one is St. John's Wort. Now, St. John's Wort is very well known to help with depression, especially with more mild depression, not so much with severe depression. Now, if you were taking something like an antidepressant along with St. John's Wort, this is where it definitely can interact. In fact, it is known to reduce the effects of an antidepressant. So you need to be choosing one or the other. It's not good to take both of them. I never do recommend taking both because it does have those crossed interactions with each other. So definitely be careful with that. The third one, a very common one that a lot of people do take, is vitamin C. A lot of people will take vitamin C for helping with boosting immunity or because they might be low in vitamin C levels. The reason why this is a problem is if you're taking something like an antacid, and vitamin C is known to absorb aluminum within the antacid. So this can lead into toxic levels of aluminum levels within your body if you're taking both antacid as well as vitamin C. So definitely do not mix those two. And the fourth one, which is two of them because both of them are very similar and are very common that people do take, is taking iron and also calcium. The reason why you would not want to take iron and calcium is if you are taking some kind of thyroid medication, especially something like levothyroxine. And a lot of people with hypothyroidism will take something like levothyroxine. And the reason why this is an issue is when you take iron or calcium, it is known to reduce the absorption of the thyroid medication that you're trying to use. So thyroid is a very severe health problem. And if you're taking a medication for it, you definitely do not want to be interacting iron and calcium with it. The fifth one, which is also very common, is taking something like vitamin K. If you're someone that's taking vitamin K, you got to be careful here because this can definitely interact and cause issues with taking blood thinning medications like warfarin. And what is known, it definitely interacts with this where it'll reduce the effects of warfarin. So if you're using it to thin out the blood, this can cause some major problems down the road. And this is where you definitely need to talk with your doctor if you need to supplement vitamin K and when to effectively be using it. Now, the sixth one, along the same lines of taking blood thinning medications, if you're that type of person, there's another few different supplements that you should keep in mind. One being vitamin E. So on the opposite side, what vitamin K does, vitamin E actually will increase the effects of blood thinning. So it'll be too drastic and too significant if you're taking something like vitamin E, as well as taking something like warfarin, which is also blood thinning. It will even thin out your blood too much where it can cause more bleeding and possibly even internal bleeding, which can cause some severe problems. So you really need to be careful with taking this. The seventh one is just like vitamin E would be ginkgo biloba. Ginkgo biloba also has been known to interact with warfarin and increasing blood thinning. And also what it does, it increases blood flow to the brain. So you don't want to be taking something like that, blood thinning. It has its own purpose, but you definitely want to be careful with this. If you really like this video and want more of these types of videos, then you subscribe, hit that subscribe button so that way you don't miss out on any of the future videos on ways to help and optimize, improve your brain and your health. Now, we talked a lot about blood thinning, but what if you're someone that is taking a medication for helping clotting blood? And you might be in that category where you're taking certain medications like that. So definitely the supplement that you should be looking out for and should not be taking and interacting with is golden seal. And what golden seal does, it can interact with a lot of different blood clotting medications where it will reduce the effects of the body to be able to clot blood when that is necessary for someone's health condition, which then can lead into severe bleeding, but also even bruising. So definitely do not take these together at all. Now, the ninth one, if you're someone that is taking like a diuretic or high blood pressure medications, you definitely want to make sure that you are very cautious about taking something like like licorice root. It has been known that licorice root does interact with diuretics and high blood pressure medications. In fact, to the point where it can really make the side effects even worse than what they typically can be with these types of medications. But on top of that, it has been known to cause problems of causing imbalances in potassium levels, which then can make your blood pressure fluctuate when you're taking something like licorice root and also blood pressure medication. So definitely don't take them together. And the 10th one is vitamin B6. Now I love vitamin B6. I use it a lot with my patients and clients, but this is when you are someone that has like Parkinson's disease and you're taking a medication like levodopa. It has been known to actually reduce the effects of levodopa, which that's not a very good situation. But the thing is, they kind of interact and battle against each other because levodopa can also decrease the levels of vitamin B6, which is important for people who do have Parkinson's disease. So usually you need to talk to your prescribing doctor about the effectiveness of taking probably vitamin B6 at a different time than you're taking levodopa. And there's also different options of levodopa medications that can help with the effectiveness of both taking vitamin B6 as well as taking your medication for levodopa. So a really important question is, what do you do if you are actually taking these supplements and this medication, these combos I just talked about? Well, the very first thing, you really need to go talk to your doctor about this if you decide to take this supplement and you didn't realize that they have these interactions, just so you're not causing more detriment to your health. But what I always tell my patients and clients when they are taking these type of medications, it's important to first off, I usually like to separate the timing that you're taking it. A lot of times you can take these medications and these supplements, especially if you are someone that's deficient in this particular vitamin that you need to be taking, but you also need to take the medication. So typically I'll have people take at least 4 hours apart from when they take their medication and when they actually take that specific supplement or vitamin. The best scenario, I usually will like to have them take possibly their medication in the morning, if that's when they need to be taking it, and then take their vitamin that could be interacting with this at night. So there's a long, huge gap, like 8 hours. So there's no issues of absorption issues or decreasing the effects or increasing the effects to making it worse. So for sure, definitely talk with your doctor so they can schedule this for you so you're doing the best you possibly can do for the best case scenario for you. But really when it comes down to supplements, there's a lot of things that I wish I would have known beforehand, before I went into naturopathic medical school, to learn all about the different supplements and interactions. So you should watch this video next where I dive in deep about all the things that I wish I would have known before taking supplements. So watch this video next.